Hello, welcome to the new tutorial presented by DASSI BOPDA. In this tutorial, we're going to do venous disorders and venous ulcers. So these are the two main things we're going to do. We're going to do venous disorders and venous ulcers. Okay, so now you need to point out the fact that the first thing that you're going to visualize is venous disorders. And you need to know that in the case of venous ulcers are only complications of the venous disorders. It is very rare to have a venous ulcer when you don't have a venous disorder. You must have a venous disorder before you have a venous ulcer. And to study the venous disorder, we're still going to work with the SchrDbb algorithm, which says that you're going to start with the disease at the middle, the differential diagnosis, the endemic disease. Then you go up to the cause, then you go down to the complication, then above here we have the background, then here down you have the prognosis. So this diagram is going to correspond to another diagram which corresponds to, in the middle we have the mechanism of the disease, then here we have the pathogenesis, then here we have the pathophysiology, then above we have the risk factors and the epidemiology, and lastly here is the follow-up. Okay, so this is how we are going to visualize our disease. So now, to know venous disorders, you need to know that what is first venous disorders? A venous disorder is any abnormality of the veins. Is it clear? And you need to know that the venous disorders peculiarly occur in the lower limbs. Is it clear? The venous disorder peculiarly occurs in the lower limbs. So when you want to know venous disorder which has any disorders of the veins, you must know what is the vein. So the vein is the blood vessel that transports blood from the systemic circle, from the circulation, it can be systemic or the pulmonary circulation, into the heart. Is it clear? That is the vein. Now we need to know that most of the venous disorder occur in the lower limb. So that's why you have to best understand on the anatomy of the lower limb. So for you to understand anatomy of the lower limb, you should go on the YouTube channel of SchrDbb video makers, and then there you go on the playlist of anatomy. You're going to visualize it very clearly. But now I'm just going to give you a brief review on the anatomy of the lower limbs for you to understand. Is it clear? Because the lower limb is the most important part that is involved with venous ulcers and venopathies, venous disorders. Now, so let's say that this is the lower limb of a patient. Is it clear? This is the lower limb of a patient like this, with the foot here like that. So this is the lower limb. Now let's say that this is the medial aspect. This is the medial aspect of the lower limb. Now you want to see the lateral aspect of the lower limb. So let's say that see this lower limb, we have like this, but now here this is the medial malleolus, and here instead we have this one like this. If this is the medial aspect, it means that the big toe has to be here. So this is the medial aspect and this is the lateral aspect here. So let's say that these are the two aspects of the lower limb, the medial aspect and lateral aspect. Here instead is the lateral malleolus. Now you need to know that the circulation of the lower limb is going to be divided into two. You're going to have the superficial circulation and you have the deep circulation. In the circulation of the lower limb, you have the superficial circulation and you have the deep circulation. Now for the superficial circulation, the one that drains the medial aspect from the foot up to the leg, up to the thigh, and draining at the level of the saphenous opening into the femoral vein. Is it clear? It is going to be called the greater saphenous vein. Is it clear? The greater saphenous vein. So the greater saphenous vein is going to drain in the medial aspect of the lower limb. Is it clear? All the medial aspect of the lower limb is drained by the greater saphenous vein into the saphenous opening that is going to drain into the femoral vein. Now, for the lateral circulation, you need to know that what in the lateral aspect, you are instead going to have the lesser saphenous vein that is going to drain the foot, is going to drain the leg. But at the level of the leg, the lesser saphenous vein is going to penetrate at the level of the popliteal fossa, and it anastomosis. It can either anastomose with the greater saphenous vein, or is going to penetrate in order to enter the deep vein, which is the popliteal vein. Is it clear? So that one is for the superficial circulation. So the superficial circulation of the lower limb, it is made up of the lesser and the greater saphenous vein. Now the deep circulation of this deep venous drainage of the lower limb. The deep venous drainage of the lower limb just follow the arterial drainage. For the deep venous drainage, you need to know that at the level of the foot in the deep, we are going to have arches. Is it clear? So arches that are going to be that are going to contain tributaries that are going to supply, that are going to drain blood into those arches. Now later on, you're going to have what is called the dorsalis pedis vein that is going to follow the dorsalis pedis artery anteriorly, and posteriorly you're going to have the posterior tibial vein that is also going to follow the posterior tibial artery posteriorly, and laterally you have the fibular vein. Is it clear? The fibular vein that is going to follow the fibular artery. Is it clear? So all of these three are going to move up. Is it clear? They move up. Now the fibular vein and the dorsalis pedis and the fibular vein and the posterior tibialis are going to bind together to produce the tibiofibular trunk. Is it clear? And that's still going to the tibiotibular trunk vein that is still going to follow the tibiofibular artery, while the dorsalis pedis is going to move up. Is it clear? Now at the level of the poplitea, the dorsalis pedis and the dorsalis pedis and the tibiofibular trunk, the tibiofibular vein are going to the dorsalis pedis and tibiofibular vein are going to bind together to produce now the popliteal vein, where the lesser saphenous vein is going to drain inside. Is it clear? That's a deep circulation. Now the popliteal vein goes up at the level of the thigh. It is now going to be called the femoral vein in the thigh. Is it clear? And when it continuously goes up, where the greater saphenous vein now is going to drain into that femoral vein, is now going to be the femoral vein as the saphenous hiatus. Is it clear? So that is a brief anatomy on the explanation of that. Now, so after knowing the brief anatomy, you have to understand that there are certain types of the venous disorder. There are certain venous disorder that you have to note. Is it clear? The venous disorder can be divided into two. Venous disorder under the pathogenesis of the venous disorder, they are divided into two. You have either a primary venous disorder or you have a secondary venous disorder. Is it clear? So those are the two major types of venous disorders or venopathy. So when you want to study venopathies, you have either primary venous disorder or you have secondary venous disorder. Is it clear? So those are the types of venous disorders. And now you need to know that when you have these different types of venous disorder, that one is going to help you to understand the different risk factors that you're going to have when you have deep venous thrombosis and when you have varicose veins. Is it clear? So now that's where we are now going to move to the next tutorial.